The monitor screams. 3 sharp beeps cut through the chaos of the ER, and I'm running before my brain catches up to my legs. The hallway blurs. White walls, fluorescent lights, the smell of antiseptic mixing with something metallic. My sneakers squeak against linoleum as I round the corner into Bay 7, and what I see stops me cold. An elderly man lies motionless on the gurney, his skin the color of old newspaper. His chest isn't moving. The nurse beside him, Maria, I think her name is, has her hands positioned over his sternum, ready to begin compressions. But she's frozen, staring at me with wide eyes that say, "You're the doctor now. What do we do?" I'm 27 years old, 6 months into my residency at Hospital St. Halsted, and this man is dying. But here's the thing that makes my stomach twist. I recognized him the moment I saw his face, because just 4 hours ago, I watched him leave this same ER against medical advice, his daughter's arm locked around his shoulders, practically dragging him toward the exit while he protested weakly. "We're going home, Dad," she'd said. Not a question, a declaration. And now he's back, unresponsive, pulseless. What happened in those 4 hours wasn't an accident. It was a choice. And what I discovered when I started piecing it together would make me question everything I thought I knew about healing, family, and the promises we make to the people we love. My name is Dr. Noah Reyes, and I'm in my first year of internal medicine residency at St. Halsted. It's a mid-sized hospital in a quiet American city that nobody's heard of unless you live here. The kind of place where everyone knows the mayor's name and Friday night football is sacred. The hospital itself is old but well-maintained, with that particular smell that all hospitals share. Industrial cleaner trying to mask the underlying scent of human vulnerability. I grew up in Houston, the son of immigrants who worked 3 jobs between them to send me to college. My mother cleaned houses. My father drove trucks across state lines, sometimes gone for weeks. When I got into medical school, my mother cried for an hour straight, and my father just nodded once and gripped my shoulder so hard it left a bruise. That bruise felt like a medal. So I don't take this lightly. This white coat, this stethoscope around my neck, the hospital badge that says resident physician. Every patient I see carries the weight of my parents' sacrifice. Every decision I make echoes with their voices. You have to be better. You have to work harder. You have to matter. The morning started ordinary. I'd been on shift since 6 a.m., covering the internal medicine service with my attending, Dr. Marcus Webb, a 52-year-old physician with silver hair and a reputation for being brilliant and terrifying in equal measure. He had this way of asking questions that made you realize how little you actually knew, even when you thought you had the answer. We'd rounded on our admitted patients first. Mrs. Chen with her congestive heart failure, Mr. Patterson recovering from pneumonia, young Jessica Torres with a mysterious autoimmune flare. Then we'd rotated down to the ER to help with consults, the emergency department physicians calling us when they needed an internal medicine perspective on a complicated case. That's where I first met Mr. Gerald Hartwell. He came in around 8:30 a.m., brought by ambulance from his daughter's house. The paramedics reported he'd been found by his daughter that morning, confused and weak, unable to stand without assistance. He was 73 years old, retired postal worker, widowed for 5 years. His daughter, Rebecca Hartwell, 46, had ridden in the ambulance with him, her hand never leaving his arm. I remember the first moment I walked into his bay. The morning sun was streaming through the high windows of the ER, casting long rectangles of light across the floor. Mr. Hartwell sat propped up on the gurney, his hospital gown hanging loose on his thin frame. He had kind eyes, the watery blue of faded denim, and hands that trembled slightly when he tried to gesture. Rebecca stood beside him like a sentinel. She was tall, with dark hair pulled back in a severe ponytail, and wore a navy blazer over jeans, as if she'd interrupted some professional commitment to be here. Her face was a mask of controlled concern, the kind of expression you see on people who are used to being in charge, who don't like feeling helpless. "Mr. Hartwell," I'd said, extending my hand. "I'm Dr. Reyes from internal medicine. How are you feeling?" His voice came out thin and reedy. "Tired, mostly. Confused about all this fuss. Dad's been having dizzy spells," Rebecca cut in before her father could say more. "For weeks now. And this morning he couldn't get out of bed without help." His hands were shaking so badly he dropped his coffee. I nodded, pulling up a rolling stool to sit at eye level with my patient, something Dr. Webb had taught me early on. "Never tower over people when they're vulnerable," he'd said. "It changes the power dynamic in ways that make honest conversation harder." "Mr. Hartwell, can you describe the dizziness for me? Does the room spin? Or is it more like you feel lightheaded?" Like you might pass out. He thought about it, his brow furrowing. Second one. Like I'm gonna faint, especially when I stand up. And how long has this been happening? Rebecca answered again. 3 weeks, maybe 4. But he kept insisting it was nothing. You know how men are, doctor. Stubborn as hell. Mr. Hartwell gave his daughter a look that was part affection, part exasperation. I didn't want to bother anyone. It's probably just old age, but it wasn't just old age. As I examined him, checking his vital signs, listening to his heart and lungs palpating his abdomen, I started building a differential diagnosis in my mind. His blood pressure was low, especially when he sat up, 95/60 lying down, 85/55 sitting. His pulse was regular but weak. His skin had a subtle bronze tint that I'd initially attributed to sun exposure, but now I wasn't so sure. I spent extra time looking at his hands, turning them over to examine the palmar creases. There it was, that characteristic hyperpigmentation, darker in the lines and folds. His gums, too, when I asked him to open his mouth, showed patches of increased pigmentation. These were subtle findings, the kind that could easily be missed if you weren't looking for them. Mr. Hartwell, have you lost any weight recently? I asked. He glanced at Rebecca. Maybe a little. My pants are looser. How much would you estimate? 10, 15 pounds? Over the last couple months. I made notes, my suspicion growing stronger. Any salt cravings? Finding yourself reaching for the salt shaker more than usual? His eyes widened slightly. Actually, yeah. Rebecca's been on my case about it. Says I'm oversalting everything. Salt craving was a classic sign. The body's attempt to hold on to sodium when the adrenal glands weren't producing enough aldosterone. Combined with the orthostatic hypotension, the hyperpigmentation, the weight loss, and the progressive weakness, the picture was becoming clearer. I ordered labs, complete blood count, comprehensive metabolic panel, thyroid function, cortisol level, vitamin B12, an EKG to rule out cardiac causes, a chest X-ray to check for pneumonia or fluid. While we waited for results, I went to find Dr. Webb. I found him in the physician workroom, a cramped space with a computer, a coffee maker that had seen better decades, and a single small window overlooking the parking lot. He was typing notes, his reading glasses perched on the end of his nose. Dr. Webb, I said, hovering in the doorway, I've got a consult in Bay 12, 73-year-old male with orthostatic hypotension, generalized weakness, and some confusion. I'm thinking volume depletion versus medication side effect versus something endocrine. He glanced up, his gray eyes sharp behind the lenses. What makes you think endocrine? The hyperpigmentation. It's subtle, but I noticed his skin has this bronze quality, especially around his knuckles and in the creases of his palms. Also, palmar creases and buccal mucosa, and the weakness has been progressive over weeks, not days, plus weight loss and salt cravings. Doctor. Webb removed his glasses and stood, which was his way of signaling that this case had his attention. What did you order? I ran through my lab panel, and he nodded approvingly. Good, but add an ACTH level and an aldosterone-renin ratio. If you're thinking Addison's disease, we need to prove it before his blood pressure drops further. Also, get a morning cortisol if possible, though given the time of day, a random cortisol will have to do. Addison's disease, primary adrenal insufficiency. The adrenal glands failing to produce enough cortisol and aldosterone, leading to fatigue, weakness, weight loss, low blood pressure, and that characteristic hyperpigmentation from elevated ACTH. It's rare, affecting maybe 1 in 100,000 people, and it's often missed because the symptoms are so non-specific. But if I was right, it was also dangerous. An Addisonian crisis, acute adrenal failure triggered by stress, infection, or sudden steroid withdrawal, could lead to shock, seizures, coma, and death. We walked back to Bay 12 together. Dr. Webb introduced himself to Mr. Hartwell and Rebecca with that calm authority that made patients relax instantly, even though he was about to ask uncomfortable questions. Mr. Hartwell, Dr. Webb began, have you noticed any changes in your appetite recently? Any nausea, vomiting, or abdominal pain? The old man thought about it. Now that you mention it, food hasn't tasted right for a while. And yeah, my stomach's been upset. I thought maybe it was just stress. Stress about what? A glance passed between father and daughter, so quick I almost missed it. Just life stuff, Mr. Hartwell said vaguely. Dr. Webb didn't push. Instead, he performed his own examination, methodical and thorough. I watched him work, noting how he took his time, how he explained each step to the patient, how he made Mr. Hartwell feel like the most important person in the world at that moment. When he finished, he pulled me aside, out of earshot. "You're right about the hyperpigmentation," he said quietly, "and that blood pressure is concerning. If his labs confirm Addison's, we'll need to admit him for IV hydrocortisone and fluids. This isn't something we can manage outpatient, not when he's this unstable." "Understood. But Noah," Dr. Webb added, his voice dropping lower. "Watch the family dynamic here. Something's off. The way she answers for him, the way he defers to her. It could be normal daughter looking after aging father stuff, or it could be something more complicated. Keep your eyes open." I nodded, though I wasn't sure exactly what I was supposed to be watching for. The labs came back 2 hours later, and they confirmed it. Mr. Hartwell's cortisol was dangerously low at 2.1 mcg/dl when it should have been at least 10. His sodium was low at 128, his potassium was elevated at 5.8. The ACTH level was sky high at 847 pg/ml, meaning his pituitary gland was screaming at his adrenal glands to produce hormones, but the adrenals weren't responding. Classic primary adrenal insufficiency. I printed out the results and found Dr. Webb reviewing another patient's chart. "Labs are back," I said. "It's definitely Addison's. Cortisol's critically low, ACTH is through the roof, electrolytes are consistent." He reviewed the numbers, his expression grave. "That cortisol level is dangerously low. He could crash at any moment. Let's go talk to them." I returned to Bay 12 to explain the diagnosis and the plan. Rebecca was on her phone, pacing near the window. Mr. Hartwell was dozing lightly, his head tilted back against the pillow. "Ms. Hartwell?" I said softly, not wanting to startle her. She turned, slipping her phone into her blazer pocket. "Yes? We have your father's lab results. It looks like he has a condition called Addison's disease. His adrenal glands aren't producing enough of certain hormones, which is causing his low blood pressure, weakness, and dizziness." Her expression didn't change. "Is it serious?" "It can be, especially if untreated. The good news is it's very manageable with medication. But right now, his levels are concerning enough that we need to admit him to the hospital for a few days. We'll give him IV steroids and fluids to stabilize him, and then transition him to oral medication he'll take daily." Dr. Webb stepped forward. "Ms. Hartwell, I want to be very clear about the urgency here. Your father's cortisol level is critically low. Cortisol is a stress hormone that helps the body respond to illness, injury, and other challenges. Without it, even minor stressors can trigger a life-threatening crisis. We need to replenish his cortisol levels in a controlled environment where we can monitor him closely. Oral medication daily," she repeated slowly. "For how long?" "For life," I said. "But it's a simple regimen, usually just hydrocortisone pills, sometimes with another medication called fludrocortisone. Once we get the doses right, most people feel completely normal and can live regular lives." She was quiet for a moment, processing. Then she shook her head. "He's not staying." I blinked. "I'm sorry?" "My father's not staying in the hospital. We're going home." I glanced at Mr. Hartwell, who had woken up and was watching our conversation with tired eyes. "Ms. Hartwell, I understand hospitals aren't pleasant places, but your father's condition is serious. His blood pressure is unstable, and if it drops further, he could go into shock. We need to monitor him closely. We'll monitor him at home." Dr. Webb's voice was gentle but firm. "Ms. Hartwell, with all respect, monitoring at home isn't sufficient in this case. Your father needs intravenous steroids, medication delivered directly into his bloodstream. He needs continuous cardiac monitoring. He needs blood work checked every few hours to make sure his electrolytes are normalizing. These aren't things that can be done at home. Then give him the pills now and we'll leave." "It's not that simple," I said. "We need to make sure he responds to the treatment first, and we need to determine the correct dosing. That takes time and observation." Rebecca's jaw set in a stubborn line. "You don't understand. Every time my father has been admitted to a hospital in the last 3 years, something has gone wrong. Every single time." Dr. Webb pulled up a stool, settling in at her level, the same technique he'd taught me. "Tell me about that." "What happened?" She seemed surprised that he'd asked, that he was actually listening instead of lecturing. She glanced at her father, who nodded slightly. 2 years ago, Dad had a pacemaker placed. Simple procedure, they said. He developed a post-operative infection, spent 10 days on IV antibiotics. Then last year, he had pneumonia. Came to the ER, got admitted, developed hospital-acquired C. diff from the antibiotics. Lost 20 pounds from the diarrhea and spent a month recovering. 6 months ago, he had a fall at home, broke his hip. During the hip surgery, he had a reaction to the anesthesia, stopped breathing for 90 seconds. The nurses told me he almost didn't make it. Her voice was shaking now, the controlled facade cracking. And each single time, I've had to fight to get anyone to listen to me. I've had to stand in hallways and demand to speak to supervisors because call buttons go unanswered. I've had to double-check medications because nurses were about to give him drugs he's allergic to. I've had to be his advocate, his protector, because if I'm not, he's just another bed number to be processed. The pain in her words was palpable. I could see Dr. Webb processing this, his expression thoughtful. "I hear you," he said. "And I'm not dismissing any of that. Hospital care isn't perfect. Medical errors happen. Communication breaks down. And I'm genuinely sorry that you and your father have had those experiences. But," Rebecca said bitterly, "but the alternative right now is worse. Your father's cortisol is at a level where any stressor, a fall, an infection, even severe emotional distress, could trigger a crisis that would stop his heart. At home, you won't be able to reverse that. Here, we can." "How long?" she asked. "If we stay, how long would he be here?" "Minimum 48 hours, possibly longer depending on how he responds. We'd start high-dose IV steroids, monitor his electrolytes and blood pressure closely, and once he's stable, we'd transition to oral medications and teach you both how to manage his condition long-term." Mr. Hartwell spoke up, his voice weak but clear. "Becca, maybe we should listen to them." She turned to him sharply. "Dad, you said you never wanted to be hospitalized again. You made me promise. I know what I said, but I don't want to die either." The words hung in the air between them, heavy with meaning. Rebecca's eyes filled with tears. "I can't lose you. Not like we lost Mom. You won't lose me, but you have to let them help." For a moment, I thought she might agree. Her shoulders sagged, her hands unclenched, but then her phone buzzed, and she glanced at it. Whatever she saw on that screen changed something in her face. "No," she said firmly. "Dad, we talked about this. You told me you trusted me to make the right decisions for your care, and I'm making one now. We're going home." Dr. Webb tried again. "Ms. Hartwell, if your father were to experience an Addisonian crisis at home—" "I understand the risks, doctor, and I'm still saying no." "Then I need to be very clear about what you're refusing. Your father could collapse within hours. His heart could stop. He could have seizures. He could go into a coma. And by the time you call 911 and paramedics arrive, it may be too late to save him." "I understand. Do you? Because I'm not sure you do. This isn't like refusing treatment for a chronic condition that will kill him slowly. This is refusing treatment for an acute, life-threatening emergency. If he dies at home tonight, you'll have to live with the knowledge that it was preventable." Rebecca's face went white, but her voice didn't waver. "Doctor, I appreciate your concern. I really do. But my father has the right to refuse treatment, and I have his healthcare power of attorney. We're leaving. I should have pushed harder. I should have paged Dr. Webb's supervisor, should have called ethics, should have tried to convince them both that this decision could be fatal. But I was tired, and there were 6 other patients waiting to be seen. And somewhere in the back of my mind was the knowledge that patients have the right to refuse treatment, even when it's against medical advice." Dr. Webb wasn't giving up yet. "Mr. Hartwell, is this truly your wish? To leave the hospital right now?" The old man looked at his daughter, and I saw something complicated pass between them. Love and fear and obligation all tangled together. "I want to go home," he said quietly. "I trust my daughter to take care of me." There was nothing more we could say. So I documented everything carefully. The diagnosis, the recommendation for admission, the detailed explanation of risks we'd provided, the family's refusal. I gave Rebecca a prescription for oral hydrocortisone with detailed instructions on dosing. I wrote out a list of warning signs that would necessitate an immediate return to the ER. Worsening confusion, severe nausea or vomiting, extreme weakness, chest pain, difficulty breathing, loss of consciousness. I explained each warning sign twice, made her repeat them back to me, and gave her my direct number at the hospital in case she had questions. She signed the AMA form, against medical advice, without hesitation, her signature sharp and decisive. And then she took her father by the arm, helped him dress in his street clothes, and walked him out of the emergency department while I stood there feeling like I'd just failed some crucial test I didn't know I was taking. "Doctor," Webb found me 15 minutes later, staring at Mr. Hartwell's chart on the computer screen. "He left," I said before he could ask. "I heard. You documented everything?" "Yes, then you did what you could." He paused, and I could hear the weight in his silence. "This happens, Noah. People make choices we don't agree with. All we can do is provide information and respect autonomy. But what if he dies? What if she calls 911 in 6 hours and he's already gone? Then that will be tragic, and it will be hard to live with, but it won't be your fault. He placed a hand on my shoulder. You gave them the information they needed to make an informed decision. They chose differently than you would have, but that's their right. You can't force people to be saved. But there was something in his tone that suggested he didn't entirely believe that either. The afternoon passed in the usual blur of patience and paperwork. A young woman with a kidney infection who cried when I told her she needed to be admitted. An elderly man with COPD exacerbation who'd run out of his inhalers 2 weeks ago because he couldn't afford the copays. A middle-aged executive having a panic attack that he was convinced was a heart attack until his EKG and troponin came back normal, and he sat in embarrassed silence while I explained the physical symptoms of anxiety. But I couldn't stop thinking about Mr. Hartwell. Between patients, I found myself pulling up research articles on Addison's disease, reading case reports of Addisonian crises, studying the mortality statistics. The numbers weren't encouraging. Without treatment, the mortality rate for Addisonian crisis was significant. Even with treatment, if it was delayed too long, the outcomes were poor. I kept imagining Rebecca at home, watching her father deteriorate, not recognizing the signs until it was too late. Around 3 p.m., I took a break to grab coffee from the physician lounge. Maria, the ER nurse who'd been in the room when Rebecca took her father home, was there making tea. "You okay?" she asked, glancing at me. "You look like you're trying to solve a puzzle in your head." I hesitated, then figured there was no harm in talking it through. "That patient from this morning, Mr. Hartwell, did something about that situation seem off to you?" Maria considered this while dunking her tea bag. "The daughter, you mean?" "Yeah, she was intense. But I've seen a lot of adult children who get overprotective when their parents are sick. It's not always a red flag." She answered for him a lot. "Some people do that. Doesn't necessarily mean she's controlling. Could just mean she's scared and trying to maintain some illusion of control." Maria paused. "Why? You think something else was going on?" "I don't know. Maybe I'm reading too much into it. But Dr. Webb noticed it too, said the family dynamic was off." Maria was quiet for a moment, stirring her tea thoughtfully. "There was one thing, though. When you went to talk to Dr. Webb, I was in there adjusting his IV. The daughter got a phone call and stepped into the hallway. I could hear her through the curtain. She wasn't trying to be quiet. She told whoever was on the line that she wasn't letting them take him and that she had everything under control." My coffee went cold in my hand. "She said them? Not him? Them. Like she was talking about the hospital maybe, or doctors in general." Maria shrugged. "Could have been nothing. People say weird stuff when they're stressed." "What else did she say?" "Something about keeping promises and not this time." Then she saw me looking and moved further down the hall. That was it. The unease that had been sitting in my chest since that morning solidified into something heavier. Keeping promises, not letting them take him, everything under control. What kind of promise had she made? And to whom? Did the father seem scared? I asked. Like he wanted to stay but she was forcing him to leave? Maria shook her head. That's the thing. He didn't seem scared of her. He seemed resigned, maybe? Like he'd already accepted whatever she'd decided, but not in a coerced way. More like he trusted her judgment more than he trusted his own. That somehow made it worse. I went back to work, but the feeling followed me. Through the rest of my shift, through sign out to the night team, through the drive home to my small apartment across town. I kept seeing Mr. Hartwell's tired eyes, hearing Rebecca's steel-edged voice. "We're going home." I made dinner, leftover rice and chicken, and tried to watch something mindless on TV, but I couldn't focus. My mind kept running through possibilities. Had Rebecca made some kind of promise to her father about not hospitalizing him? Was there a financial reason? Maybe they couldn't afford the hospital bills? Was there some cultural or religious belief I'd missed? Or was it simpler than that? Was she just a daughter who'd watched her father suffer through multiple hospitalizations and couldn't bear to put him through another one? Finally, around 9 p.m., I pulled out my laptop and looked up Addison's disease outcomes, reading study after study. About Addisonian crises, about how quickly patients could decompensate without treatment. One case report described a patient who'd refused treatment and died within 8 hours. Another described a patient who'd gone home and returned to the ER in fulminant shock, requiring massive resuscitation and dying anyway 3 days later. The mortality rate for untreated Addisonian crisis was high, very high. I closed the laptop and went to bed, but sleep came in fragments, interrupted by dreams of monitors beeping and flat lines and voices calling code blue. At 1:47 a.m., my phone rang. I jerked awake, fumbling for the device on my nightstand. The screen showed a hospital number. My heart was already racing before I answered. "Dr. Reyes," I mumbled, my voice thick with sleep. "Noah, it's Maria from the ER. We need you down here. It's Mr. Hartwell, the Addison's patient from this morning. He came back about 20 minutes ago. Unresponsive. Daughter called 911 from their house." My heart kicked into overdrive. "Is he? He's alive, but barely. Dr. Webb's on his way in. He said to get you here too." I was dressed and in my car within 5 minutes, speeding through empty streets with my hazard lights flashing, my mind racing faster than the engine. What happened? Did he crash from the disease? Did she not give him the medication? Was there an accident? Why didn't she call sooner? The streets were empty at this hour, streetlights casting orange pools on dark asphalt. I ran 2 red lights where I could see no traffic in any direction, my hands gripping the steering wheel so hard my knuckles ached. I pulled into the hospital parking lot, abandoning my car in the closest spot I could find, and ran through the automatic doors into the ER. Bay 7 was chaos controlled by years of training. Maria was bagging Mr. Hartwell, squeezing oxygen into his lungs with a manual ventilator because he couldn't breathe on his own. Another nurse was placing an IV, her movements quick and precise. A respiratory therapist was setting up the intubation equipment, checking the laryngoscope blade, preparing the endotracheal tube. And in the corner, looking small and destroyed, was Rebecca Hartwell, her hands covering her mouth, her eyes wide with horror. Dr. Webb arrived 30 seconds after I did, already in scrubs, his face set in grim determination. He assessed the scene in an instant. "What do we have?" he barked. 73-year-old male with diagnosed Addison's disease, left AMA this morning, Maria reported, her hands never stopping their rhythm on the bag valve mask. Found unresponsive at home by daughter approximately 2 hours ago. She called 911. Paramedics arrived to find him pulseless, started CPR, got spontaneous circulation back after 2 rounds of epinephrine. GCS-3 on arrival here, he's completely unresponsive. Pupils are sluggish but reactive. Blood pressure is 75/40, heart rate 110, saturating 88% on 100% oxygen. Dr. Webb turned to me. "Get me a blood gas, lactate, cortisol, basic metabolic panel, and cross-match 2 units of packed red blood cells. Start stress dose steroids now, hydrocortisone 100 milligrams IV push, then start a continuous drip at 10 milligrams per hour. Wide open normal saline through 2 large bore IVs. We're intubating." I moved automatically, my training overriding my fear. I pushed the hydrocortisone while Maria kept bagging. The respiratory therapist prepared the laryngoscope, laying out the equipment in precise order. Dr. Webb positioned himself at the head of the bed, his movements calm despite the urgency. "I need to intubate," he said. "Everyone ready?" We nodded. Maria stopped bagging. Dr. Webb inserted the blade, lifting the tongue and jaw to visualize the vocal cords. His hand was steady as he slid the endotracheal tube home with practiced precision. The respiratory therapist attached the ventilator, and I listened with my stethoscope to confirm placement. Equal breath sounds bilaterally. "Tube's good," I confirmed. The monitor showed a heart rate of 110, blood pressure 75/40. Despite the fluids we were pouring in, oxygen saturation slowly climbing to 92%. "He's in Addisonian crisis," Dr. Webb said, more to himself than to us. "But this degree of shock suggests more than just steroid deficiency. Noah, examine his abdomen." I pulled up Mr. Hartwell's gown and pressed gently on his belly. It was rigid, board-like, a sign of severe intra-abdominal pathology. When I pressed and released, he didn't flinch or react at all, which was somehow more alarming than if he'd responded to pain. "Peritonitis," I said. "Rigid abdomen, no response to palpation. Or perforation. Get me a CT scan stat. Chest, abdomen, pelvis with contrast. And call surgery. If there's a bowel perforation, he'll need an OR tonight." While we waited for the CT scanner to be ready, while we continued pouring fluids and medications into Mr. Hartwell's failing body, I approached Rebecca. She hadn't moved from her corner, hadn't made a sound. Tears streamed down her face silently. "Ms. Hartwell," I said gently, keeping my voice low, "can you tell me what happened after you left the hospital?" She looked at me with hollow eyes, eyes that had seen something break that couldn't be unbroken. "We went home. I gave him the medicine like you said, 3 pills, just like on the prescription. He seemed okay for a few hours, tired but okay. We watched TV together. He ate some soup for dinner, not much, but some. And then, Around 9 p.m., he said he felt nauseous. He threw up twice. I gave him crackers, ginger ale, tried to keep him hydrated, but he couldn't keep anything down. By 11, he was saying his stomach hurt. By midnight, he was barely conscious, mumbling things that didn't make sense. I called 911, but I should have called sooner. I should have brought him back the moment he started vomiting, but I thought... Her voice broke. I thought I could handle it. I thought I was protecting him by keeping him home. There was no judgment I could offer that would be worse than what she was already inflicting on herself. We're doing everything we can, I said, because there was nothing else to say. She grabbed my arm suddenly, her grip surprisingly strong. Is he going to die? Please, just tell me the truth. Is my father going to die because of me? I wanted to lie. I wanted to give her false hope, to ease the crushing guilt I could see destroying her from the inside. But Dr. Webb had taught me that honesty, delivered with compassion, was better than comfortable lies. I don't know, I said. He's very sick, but we're not giving up on him. The CT scan showed a perforated gastric ulcer, a hole in the stomach wall that had been leaking stomach acid and partially digested food into his abdominal cavity, causing a severe infection and toxic shock. The radiologist's report noted free air under the diaphragm, fluid in the peritoneal cavity, and signs of early sepsis. Combined with the untreated Addison's disease, his body had simply run out of reserves. The stress of the perforation had triggered an Addisonian crisis, and the crisis had worsened the shock from the perforation, a vicious cycle that was shutting down his organs one by one. Dr. Webb called the surgical team. Dr. Patricia Yoon, the general surgeon on call, arrived within 20 minutes, still in her scrubs from a previous case. She reviewed the CT images with us, her expression grave. He's in septic shock, she said. Blood pressure's marginal even with pressors. But if we don't operate, the peritonitis will kill him for sure. If we do operate, he might not survive the anesthesia in his current state. So what do? I asked. We optimize him as much as possible in the next hour, get his pressure up, correct his electrolytes, continue the steroids. Then we take him to the OR and hope for the best. She turned to Dr. Webb. You'll need to come with us. His endocrine issues make him too unstable for me to manage alone. Within 30 minutes, Mr. Hartwell was being wheeled to the operating room, still intubated, still barely alive, surrounded by IV poles and monitors and the grim determination of people who'd seen impossible cases survive before. Rebecca walked alongside the gurney as far as she was allowed, then stopped at the line she couldn't cross, watching her father disappear through double doors that swung shut with a pneumatic hiss. I stayed at the hospital even though my shift was over. Dr. Webb had gone into the OR with the surgical team. I sat in the surgical waiting room with Rebecca, who had called her brother, Mr. Hartwell's son, who lived 2 states away and was now frantically trying to book a flight. The waiting room was empty except for us. Fluorescent lights hummed overhead. A TV in the corner played news on mute. The chairs were that particular shade of blue-gray that seemed designed to fade into the background of human suffering. Rebecca sat motionless, staring at her hands. Why didn't you tell us about the stomach pain? I asked quietly, after the silence had stretched too long. When he was here this morning, Dr. Webb asked if he'd had abdominal pain. You both said no. Rebecca's hands twisted in her lap. He didn't. Or if he did, he didn't tell me. Dad's always been stoic. He hates complaining. My mother used to say he once walked around for 2 days with appendicitis before she dragged him to the hospital. Her voice caught. And I was so focused on getting him away from the hospital, I didn't think to ask more questions. I didn't do a full assessment like I should have. I just assumed the nausea and weakness were from the Addison's disease you'd diagnosed. Why? I asked, the question I'd been holding since this morning. Why were you so determined to take him home? She was quiet for a long time. When she finally spoke, her voice was raw. 5 years ago, my mother died in a hospital. Not this one, a different one, back east where they lived then. She went in for what should have been a routine gallbladder surgery. She was 68, healthy, active. The surgery was supposed to take an hour. Rebecca paused, swallowing hard. But something went wrong with the anesthesia. They said her blood pressure dropped suddenly, unexpectedly. They tried to reverse it, but she had a massive stroke on the table. They kept her alive for 3 weeks on machines, but she never woke up. Never opened her eyes, never squeezed our hands, nothing. Just machines breathing for her. Machines keeping her heart beating, machines measuring the absence of the person she used to be. Tears were streaming down her face now, but she kept talking, as if saying it all out loud might somehow change the ending. My father sat by her bed every single day. He talked to her, read to her, played her favorite music. He was convinced she could hear him, that she'd wake up if he just waited long enough. But I could see it in the doctor's eyes. They knew she was gone. They knew we were just delaying the inevitable. Finally, after 3 weeks, I was the one who said we had to let her go. I was the one who told them to turn off the machines. And my father, he never forgave me for that. Not in words, but I could feel it. He looked at me differently after, like I'd given up on her when he never would have. She wiped her eyes roughly. So when Dad moved out here to be closer to me, when he started having health problems, I promised him, I swore to him, that I would never let him end up like that. I would never let doctors hook him up to machines and keep him alive past when he wanted to be alive. I would be his protector, his advocate. I would make the hard choices so he wouldn't have to. That's why you took him home, I said softly. You were keeping a promise. I thought I was keeping him safe. I thought hospitals were the danger, that doctors were the enemy trying to take control of his life. But I was wrong. The real enemy was my own fear, my own guilt. And now, she gestured helplessly toward the surgical suite. Now he might die because I couldn't see past my own trauma. I didn't know what to say to that. There was truth in it, and pain, and a kind of recognition that cut deep. We sat in silence for a while. Then Rebecca spoke again, her voice barely above a whisper. There's something else, something I didn't tell you. I waited. Dad's been talking about death a lot lately, about being tired, about wanting to be with my mother again. Part of me wonders if that's why he agreed to leave the hospital. Not because he was afraid of it, but because he was ready to stop fighting. Did he tell you that explicitly? No, but I know my father. And I keep thinking, what if I pushed him to come home not because he wanted it, but because I couldn't face losing him the way we lost her? What if I was so obsessed with keeping my promise that I didn't stop to ask if it was still what he actually wanted? Before I could respond, the surgical waiting room doors opened. Dr. Webb walked in, still in his surgical scrubs, his mask pulled down around his neck. His face was exhausted but not defeated. Rebecca stood immediately. He's alive, Dr. Webb said. The surgery went as well as could be expected given the circumstances. I felt something unclench in my chest. We found the perforated ulcer in his stomach, Dr. Webb continued. Dr. Yoon repaired it, washed out the abdominal cavity, placed drains. The peritonitis was extensive, and he'd lost a significant amount of blood into his abdomen, which complicated things. We gave him 3 units of blood, continued the stress dose steroids throughout, and managed to keep his blood pressure stable enough to complete the operation. Will he survive? Rebecca asked, her voice shaking. Dr. Webb chose his words carefully. The next 72 hours are critical. He's on a ventilator, multiple pressors to support his blood pressure, continuous dialysis because his kidneys shut down from the shock. His body went through tremendous trauma, not just from the perforation, but from the untreated Addison's disease, from the delayed treatment, from the surgery itself. It's going to be a long road, but there's a chance. There's a chance. He's a fighter, and now that we've corrected the acute problems, we can focus on supporting his body while it heals. Rebecca collapsed back into her chair, her body shaking with sobs, relief and guilt and exhaustion all colliding at once. Dr. Webb sat down beside her, his voice gentle. Ms. Hartwell, I want you to understand something. Your father's ulcer wasn't caused by coming to the hospital or by leaving it. Gastric ulcers develop over time, often from chronic use of medications like aspirin or ibuprofen, or from bacterial infections, or from stress. The Addison's disease made him more vulnerable, but the perforation would have happened regardless of whether he was home or here. But if you'd stayed, we would have caught it sooner, yes. The outcome might have been better, but it also might not have changed anything. Perforations can happen suddenly without warning. You couldn't have prevented this. I still should have brought him back sooner. When he started vomiting, when he said his stomach hurt, I should have called 911 immediately. Yes, Dr. Webb said, and the honesty in his voice was kinder than false comfort would have been. That would have been better. But you can't change the past. All you can do is learn from it and make different choices moving forward. He stood, preparing to return to the ICU. Your father's going to be sedated for at least the next 24 hours. You should go home, get some rest. There's nothing you can do here right now. I'm not leaving him. Dr. Webb nodded, as if he'd expected that answer. Then at least try to sleep. There's a waiting room with recliners on the ICU floor. Noah can show you where it is. Mr. Hartwell stayed in the ICU for 9 days. I visited him every morning before my shift, watching the numbers on his monitors slowly improve. Day 3, They were able to reduce the pressors. His blood pressure was starting to maintain itself. Day 5, they weaned him off the ventilator, and he took his first spontaneous breaths, his lungs working on their own again. Day 7, he opened his eyes and recognized his daughter, his hand weakly squeezing hers. Rebecca never left. She slept in the ICU waiting room, ate vending machine food and whatever the nurses could sneak her from the staff break room. She sat by her father's bedside every moment she was allowed, talking to him even when he was sedated, reading him articles from the newspaper, playing soft music on her phone. The anger and defensiveness that had armored her in the ER had dissolved, leaving only exhaustion and guilt and a fierce determination to make things right. On day 8, when Mr. Hartwell was strong enough to speak around the tracheostomy tube they'd placed, I heard her apologizing to him through the glass window of his ICU room. "I almost killed you," she was saying, her voice thick with tears. "I thought I was protecting you, but I almost killed you. I'm so sorry, Dad. I'm so sorry." Mr. Hartwell's hand, weak but steady, reached for hers. His voice came out as a hoarse whisper. "You were trying to love me. That's not the same as trying to hurt me. But Becca, listen. I know why you did what you did. I know you were trying to keep your promise. But I need to tell you something. I should have told you years ago." She leaned closer, listening. "I never blamed you for your mother. Making that decision to let her go, that was the hardest, bravest thing you ever did. And it was the right thing. I couldn't do it because I loved her too much to let go. But you loved her enough to free her. I should have thanked you, not made you carry that guilt." Rebecca broke down completely, her head resting on the edge of his bed, her shoulders shaking. Mr. Hartwell stroked her hair with trembling fingers, the way he probably had when she was a child. I turned away, giving them privacy, and found Dr. Webb standing beside me in the hallway. "Powerful moment," he said quietly. "Yeah, this case is going to stay with you," he continued. "It's the kind that keeps you up at night, makes you second-guess every decision. But I want you to understand something important." I looked up at him. "You did everything right," he said. "You made the correct diagnosis early, explained the risks clearly, documented thoroughly. You can't force people to accept help. All you can do is offer it clearly and compassionately, and then respect their autonomy when they make choices you don't agree with. But if you'd pushed harder, she might have taken him home anyway. And then maybe she wouldn't have called 911 when things went wrong. Maybe she would have been so angry at us, so entrenched in her position, that she'd have let him die at home rather than admit she needed help." He paused, letting that sink in. "Sometimes the best thing we can do is plant seeds and trust that they'll grow when the person is ready. That feels like giving up." "No. Giving up would be dismissing her concerns, talking down to her, making her feel stupid for being afraid. You treated her like a person, not an obstacle. You acknowledged her fear, even when you disagreed with her decision. That matters more than you realize. It's why she felt safe enough to come back when things got bad. It's why she called 911 instead of letting him die out of sheer stubborn pride." I thought about that. Did you know he'd end up like this? I suspected he was at high risk. But I couldn't have predicted the ulcer perforation. That was a separate issue that happened to compound at the worst possible time. Medicine is full of these terrible coincidences, Noah. You learn to live with uncertainty. How? He smiled slightly. With difficulty. And with the knowledge that you're doing your best with imperfect information. And that's all anyone can ask. Over the next week, I watched Mr. Hartwell's recovery unfold in small, hard-won victories. Day 9, he was transferred out of the ICU to a regular hospital floor. Day 11, he was walking the hallways with a physical therapist, his steps shuffling and slow but growing steadier each day. Day 14, he was eating solid food, simple things at first, broth and crackers, then graduating to scrambled eggs and toast. Day 17, he was arguing good-naturedly with the nurses about the hospital's TV channel selection, which everyone agreed was a sign of returning health. Rebecca changed too. She started asking questions instead of making demands. She took notes during rounds, learned to check his blood pressure at home, made lists of warning signs to watch for. She asked about support groups for caregivers, about home health services, about how to advocate effectively without becoming adversarial. When Dr. Webb suggested family therapy to help process the trauma of the past weeks, she actually agreed, which surprised everyone. "I need to understand why I acted the way I did," she told me one afternoon when I stopped by to check on her father, "so I don't make the same mistakes again." On discharge day, I went to his room to say goodbye. Mr. Hartwell was dressed in his own clothes, jeans and a flannel shirt, looking more like a person and less like a patient. The color had returned to his face. His hands were steady. He looked like someone who'd survived something terrible and come out the other side changed but whole. "Dr. Reyes," he said warmly, extending his hand. "I hear you're the one who figured out what was wrong with me in the first place." I shook his hand. "Team effort. How are you feeling?" "Like I got hit by a truck, backed over, and then hit again for good measure. But alive, which I'm told wasn't a guarantee there for a while." "You gave us a scare," I admitted. "I gave myself a scare." He gestured to the chair beside his bed. "Sit for a minute. I wanted to thank you properly." I sat, curious about what he wanted to say. "Becca told me about that morning in the ER, about how you diagnosed the Addison's disease, explained everything clearly, tried to convince us to stay. She said you could have been angry with her for refusing, could have made her feel small or stupid, but you didn't. You treated her with respect, even when she was being difficult." "She was scared," I said. "Fear makes people act in ways they normally wouldn't." "True enough, but not everyone has the wisdom to see that, especially not someone as young as you." He leaned forward slightly. "Can I tell you something? Something I haven't told anyone else, not even Becca?" I nodded. "Part of me did want to leave that day. Not because I didn't trust you, but because I'm tired, Dr. Reyes. Tired of being sick, tired of hospitals, tired of fighting. When you get to be my age, when you've lost your wife and watched your body betray you piece by piece, sometimes you wonder if it's worth the struggle." His words settled heavy in the space between us. "So when Becca said we were going home, when she gave me permission to stop fighting for a while, it felt like relief, like maybe I could just rest and whatever happened would happen." He paused. "But then things got bad, and I realized I wasn't actually ready to give up. I wasn't ready to leave my kids, wasn't ready to stop seeing sunrises or tasting good coffee or hearing my daughter laugh. So when the paramedics were working on me, some part of me was fighting to stay, and that's when I knew. I wasn't ready yet." "I'm glad you fought," I said quietly. "Me too. But here's the thing I want you to understand. If you'd forced me to stay that morning, if you'd overridden my decision and Becca's decision and kept me here against our will, I would have been angry. I would have felt like a prisoner instead of a patient, and that anger might have killed any will I had to fight when things got critical." He reached out and gripped my hand. "So thank you for respecting my choice, even when it was the wrong choice. Thank you for treating me like a person capable of making decisions about my own life. That dignity mattered, and in some weird way, it's part of why I'm still here." I didn't know what to say to that. It felt like absolution I didn't deserve, but also like a truth I needed to hear. Rebecca appeared in the doorway, her brother behind her, a tall man in his 40s with his father's blue eyes and his mother's dark hair. They'd come to take Mr. Hartwell home, this time with a proper plan. Follow-up appointments scheduled, medications organized, home health nurse arranged, emergency protocols established. "Ready, Dad?" Rebecca asked. "Ready as I'll ever be." He stood slowly, steadying himself with one hand on the bed rail. Rebecca approached me before they left. "I never apologized to you properly. For how I acted in the ER, for not trusting you, for..." She gestured helplessly. "For all of it. You don't need to apologize." "I do, though. You were trying to help, and I was so scared of losing him the way we lost my mother that I couldn't see straight. I thought I could control everything if I just kept him away from hospitals. But you can't control disease. You can't control mortality. You can only..." She trailed off, searching for words. "You can only love people and do your best," I finished. She nodded, tears shining in her eyes. "He's going to be okay, isn't he? I mean, long term? With proper treatment and monitoring, yes. The Addison's disease is manageable now that we know about it and he's on the right medications. The ulcer is healed. His kidneys recovered function. He'll need regular follow-up care, dietary changes, medication compliance, but there's no reason he can't live a good long life. I'll make sure he does, I promise. The right way this time, working with his doctors, not against them." And looking at her, at the determination tempered now with humility and understanding, I believed her. 3 months later, I was grabbing coffee in the hospital cafeteria when I saw them. Mr. Hartwell and Rebecca, sitting at a corner table near the windows where afternoon sun poured in, laughing about something. He looked healthy, color in his cheeks, steadiness in his hands, weight back on his frame. She looked lighter somehow, less burdened by the weight of fear she'd been carrying. They saw me and waved me over enthusiastically. "Dr. Reyes," Mr. Hartwell said. "Sit, sit. Rebecca was just telling me about her new job." I joined them, curious. "I'm training to be a patient advocate," Rebecca explained, a hint of pride mixed with embarrassment in her voice. "It's a program through the hospital system. They teach family members how to navigate medical care, how to communicate with doctors, how to ask the right questions, how to be helpful instead of adversarial. That's wonderful, I said, genuinely impressed. I figured if I was going to be difficult, I might as well channel that energy into something productive. She smiled slightly. Plus, I keep meeting families going through the same thing I went through. Scared, overwhelmed, feeling like the medical system is this impenetrable wall. I can help them understand that doctors are people too, that they want to help, that asking questions and advocating doesn't have to mean fighting. She's already helped 3 families navigate tough conversations with their doctors, Mr. Hartwell said proudly. She's got a gift for it, knows what questions to ask, helps people feel heard without creating conflict. Turns out almost losing your father gives you a unique perspective on this stuff. Rebecca blushed. I'm still learning, but it feels good to take something terrible and make something useful out of it. We talked for a while longer about his recovery, about my residency, about the small victories and persistent challenges of healing. Mr. Hartwell was taking his medications religiously, had gained back the weight he'd lost, was even volunteering at the local library twice a week. He talked about his grandchildren, about a fishing trip he was planning with his son, about life in the present tense rather than the past. As I stood to leave, Mr. Hartwell gripped my arm gently. "Thank you," he said simply, "for not giving up on us, for understanding that we weren't trying to be difficult. We were just trying to survive the only way we knew how. I'm just glad you're doing well," I said. Rebecca walked me partway back toward the elevators. "I wanted to tell you something else," she said. "Dad and I have been doing therapy together, working through the stuff with my mother, with his hospitalizations, with our relationship, and he told me something I never knew." She paused, gathering her thoughts. "He said that when I made the decision to stop life support for my mother, he wasn't angry at me. He was grateful, because he couldn't do it himself. His love made him selfish, made him want to keep her alive even when she was gone. But I loved her enough to let her go. And he said carrying that decision for him was one of the greatest acts of love anyone had ever done for him, even though he couldn't say it at the time." Tears welled in her eyes. "I spent 5 years thinking I'd betrayed both of them, and it turns out I'd done the hardest, rightest thing. But I was so trapped in my own guilt and grief that I almost made a terrible mistake with my father because I couldn't see clearly." "You did see clearly," I said. "Eventually, when it mattered most, you brought him back, barely in time. But in time nonetheless." I paused. "You know what I've learned in residency? That medicine isn't about being perfect. It's about being human, making mistakes, learning from them, and showing up anyway." She smiled through her tears. "When did you get so wise?" "I'm not wise. I'm just surrounded by good teachers." We said our goodbyes, and I headed back to the residence workroom, where a new stack of charts was waiting, where new patients with new crises would need my attention, where the endless work of healing would continue. That night, I wrote an email to my parents. I told them about Mr. Hartwell, about Rebecca, about the lesson I'd learned in the space between respecting autonomy and fighting for someone's life. My mother wrote back the next morning with a line in Spanish that her own mother used to say, "El amor sin sabiduría es solo otra forma de peligro." Love without wisdom is just another form of danger. She was right, of course. Love isn't enough by itself. It needs to be paired with knowledge, with humility, with the willingness to accept help even when accepting help feels like admitting defeat. It needs to be tempered with the wisdom to know when holding on becomes harmful and when letting go becomes necessary. But here's what I learned in those 17 days between Mr. Hartwell's first visit and his final discharge. Sometimes the people who fight us the hardest are the ones who need us the most. Sometimes the greatest act of healing isn't fixing the body, it's helping someone understand that they don't have to carry their fear alone. Sometimes resistance isn't defiance, but a desperate attempt to maintain control in a situation that feels terrifyingly out of control. And sometimes when you're 27 years old and wearing a white coat that still feels too big, the best thing you can offer isn't certainty or expertise or even medical skill. It's patience. It's compassion. It's the quiet promise that even when people make mistakes, even when they run from the help they desperately need, you'll still be there when they're ready to turn around and come back. Because in the end, medicine isn't about being right or wrong. It's not about winning arguments or asserting authority. It's about being human together in all our flawed and frightened and beautifully resilient glory. It's about recognizing that behind every difficult family member is a story of loss, that behind every refusal of treatment is a fear that deserves to be heard, that behind every poor decision is a person trying their best with the tools they have. Mr. Hartwell taught me that. And Rebecca taught me that even broken trust can be repaired, one honest conversation at a time, and that redemption is always possible for those willing to do the hard work of growing. These are the lessons they don't teach you in medical school. These are the ones that matter most. These are the ones that will stay with me long after I've forgotten the intricate details of adrenal physiology or the exact dosing protocols for stress-dose steroids. Because medicine, at its heart, isn't about the science, though the science matters deeply. It's about the spaces between the science, the moments of connection, the acts of courage, both big and small, the choice to see patients not as problems to be solved, but as people to be understood. That's what I'm learning, one difficult case at a time. That's what makes this exhausting, humbling, magnificent work worth doing. And on the days when I doubt whether I'm cut out for this, when the mistakes feel too heavy and the responsibility feels too large, I think about Mr. Hartwell sitting in that cafeteria, healthy and whole, telling jokes with his daughter who learned to channel her fear into purpose. That image sustains me. That memory reminds me why I'm here. And that hope, the hope that even our worst mistakes can become our greatest teachers, keeps me showing up day after day, ready to try again.